Picture this, a guy I'll call Dan, 47 years old, successful, fit-looking, devoted partner. He comes to me after 18 months of avoiding sex with his wife. Not because he doesn't want her, not because the marriage is in trouble, but because the last time they tried, he lost his erection. And the shame of that one moment was so massive that he just stopped. He stopped initiating. He started going to bed late. He started picking small arguments so she'd go to sleep frustrated with him instead of wanting him. 18 months of avoiding the person he loved most in the world. And here's the thing nobody told him. His ED started because he was exhausted and had undiagnosed high blood pressure. That's it. That was the beginning. It was a physical issue, but it became this enormous psychological monster because nobody sat him down and said, hey, this is common, this is explainable, and there's real stuff happening in your body that we can address. That's what today's episode is for. We're going to talk about all the different medical causes for erectile dysfunction. Hi there, and welcome to the Great Sex Podcast. I'm your host, Dr. Heather England. I'm a coach, psychotherapist, and certified sex therapist. And I can't wait to talk to you more about ED in this limited series I'm doing on erectile dysfunction. Before we dive in, today's podcast is brought to you by my 2 on-demand online workshops on erectile dysfunction. The first is focused on mastering performance anxiety because performance anxiety is hands down the top contributor to ED, and it keeps so many men stuck in this exhausting cycle of worry and avoidance. The second workshop is designed specifically for female partners of men with ED because partners are deeply affected by this too, and they deserve their own roadmap. I'm genuinely so excited about both of these trainings, and the feedback I've gotten has been incredible. You can find the links in the show notes. Okay, so let's talk about ED. And I mean really talk about it, not in a clinical, detached, read from a textbook way, in a real, honest, this affects millions of men and their partners way. Here's what I want you to understand from the jump. ED isn't a character flaw. It's not a referendum on your masculinity. It's not a sign that you're broken or past your prime or that your relationship is doomed. It's a medical and often psychological condition with real identifiable causes. And once you understand those causes, you have so much more power to actually do something about it. So let's start at the beginning. Male sexual arousal is genuinely complex. Like more complex than most people realize. To get and maintain an erection, your brain, your hormones, your emotions, your nerves, your muscles, and your blood vessels all have to be working together. If any one of those pieces is off, it can affect your erections. That's not me being dramatic. That's just biology. And this is exactly why the quick fixes you see advertised everywhere often fail, because they're addressing one piece of a very multi-layered, complex puzzle. Now, in most cases, ED starts with something physical, and I want to walk you through the most common physical causes because I think knowledge is genuinely power here. Let's start with cardiovascular health. Heart disease, clogged blood vessels, high blood pressure, these are at the root of a huge number of ED cases. And here's the basic mechanics. To get an erection, blood has to flow into the penis in a healthy, robust way. If your arteries are narrowed from plaque buildup, that flow is compromised. It's that direct. But here's the part that stops men cold when I tell them. ED can actually precede a cardiovascular event by up to 5 years. Your penis may be giving you an early warning sign that your heart needs attention. Sometimes we call this the canary in the coal mine. And this is why I always encourage men experiencing ED to see their primary care doctor first, even before we start therapy. Not because I'm passing the buck, but because ruling out or catching cardiovascular issues early could literally save your life. Diabetes is another major one. About 85% of men with diabetes will experience ED at some point, and they tend to develop it 10 to 15 years earlier than non-diabetic men. The connection is more blood vessel and nerve damage from poorly controlled blood sugar. If you have diabetes and you're experiencing ED, please bring this up with your endocrinologist or your doctor. Obesity plays a significant role too. Research published in the Annals of Internal Medicine found that men with a body mass index or BMI of 28 or higher had a 30% increased risk of ED. But here's the hopeful flip side of that. A study in the Journal of American Medicine found that 31% of obese men with ED were able to regain sexual function simply by losing weight and increasing physical activity. The body is remarkably responsive when you give it what it needs. Let's talk about medications for a second, because this one surprises people. ED is a side effect of a lot of common medications: antidepressants, antihistamines, beta blockers, diuretics, even some heartburn medications. If you're on any of these and you've noticed changes in your erections, please don't just suffer in silence. Talk to your doctor. Sometimes switching to a different medication can make all the difference in the world. Tobacco use. The Massachusetts Male Aging Study, which followed men between the ages of 40 and 69, found that smokers nearly doubled their risk of moderate to complete ED over the next 10 years. Nearly doubled. And the good news, quitting now can actually reduce that risk. Your blood vessels can recover. They are very resilient. Alcohol deserves its own moment here. Alcohol is a depressant. During sexual arousal, your brain sends signals to your penis to become erect. Alcohol slows those signals down. Long-term heavy drinking also damages your blood vessel health, decreases blood flow to the penis, and it can interfere with testosterone production. So if you're someone who's been drinking heavily for years and you're dealing with ED, well, that's the connection. It's real and it matters. Testosterone is involved in the nitric oxide pathway, which is literally the chemical process that allows the smooth muscle tissues of the penis to relax and fill with blood, which is what gives you your erection. If your testosterone is low, that pathway gets disrupted. Now, not every man with low testosterone is going to have ED because other hormones are also in play. But symptoms of low T include reduced energy, lower sex drive, depression, poor concentration, and yes, even changes in erections. A simple blood test can tell you where your levels are. Sleep apnea is wildly underdiagnosed and underappreciated. A study published in the Journal of Sleep Medicine found that 75% of men with both ED and obstructive sleep apnea were able to reverse their ED after just 1 month of CPAP treatment. 1 month. If you snore like a freight train and your partner keeps telling you that you stop breathing in the night, please get a sleep study. It could change everything for you, and not just from an ED standpoint. It could make you be so much healthier. Okay, fatigue. This is a huge, huge, huge issue. I put this one last, but it is so common, especially for middle-aged men. Our lives are insane. We are all so busy. We work too much, we sleep too little, and then we fall into bed at 10 or 11 o'clock exhausted and expect our bodies to perform. That's not realistic. I have a thing about having sex at the end of the day because that's when we're the most tired. And that's when it really, honestly, it's hardest for our bodies to work and it's harder for us to feel arousal. Fatigue is a legitimate, real cause of ED, and it often gets dismissed because it feels too simple. But it's not simple. It's your body telling you that something needs to change. There are other physical causes too, including neurological conditions like Parkinson's disease, MS, or a history of stroke, surgery or injury to the pelvic area or a spinal cord, prostate cancer treatments. And this one breaks my heart a little because prostate cancer surgery causes postoperative ED in up to 75% of patients. Radiation often causes delayed ED that shows up 24 to 36 months after treatment, and it can worsen over time. Men dealing with this deserve so much more support than they typically get. And then there's Peyronie's disease, which is something that's not frequently talked about, but that's the development of scar tissue inside the penis that causes it to bend. And it occurs most commonly in middle-aged men and ED occurs in 30 to 40% of those who have it. So if you have noticed a curvature in your penis, you may have Peyronie's, and it is really important to bring that up with your doctor so you can discuss treatment options, because if your penis continues to bend, eventually you may not be able to penetrate with it, but there are things you can do to address it. I know that's a lot, and I want to pause here and say something important. Understanding the physical causes of ED doesn't mean that your experience is purely physical. In fact, most men who start with a physical cause like fatigue or high blood pressure very quickly develop psychological factors that then take on a life of their own. Think about our friend Dan from the beginning of this episode. His ED started from exhaustion and high blood pressure, completely physical. But then he lost his erection once, and the shame and worry from that one experience became its own separate cause of ED. That worry, that anticipatory anxiety, that hypervigilance every time he thought about sex, that's what we call a psychological or a psychosocial factor. And it's incredibly common. This is a cycle that traps so many men. Physical causes lead to one experience of ED or multiple experiences of ED, which lead to continued worry about it happening again. And that causes a performance anxiety cycle, which causes even more ED. And round and round and round it goes because it's one giant cycle. Breaking that cycle requires addressing both sides, the physical causes and the psychological. So if you're listening to this and you're dealing with ED, here's what I want you to take from today. First, see your doctor, get blood work done, get your testosterone checked, your blood pressure checked, your blood sugar checked. Rule things out or catch things early. This is not optional. This is step one. Second, look honestly at your lifestyle. Are you smoking, drinking heavily, not sleeping, carrying a lot of extra weight, not moving your body? These things matter enormously and they're changeable. Third, understand that the shame you're carrying about this is not useful and it's really not deserved. ED is so common, it's explainable, and it's very often treatable. And fourth, know that that psychological piece, the performance anxiety, the avoidance, the hit to your self-worth, that piece really matters too. That's where therapy and coaching come in. So we covered a lot of ground today. The physical causes of ED are real, varied, and often interconnected. Cardiovascular health, diabetes, obesity, medications, tobacco, alcohol, low testosterone, sleep apnea, fatigue, neurological conditions, prostate cancer treatments, and more. Any one of these can start the ED cycle, and most men have more than one contributing factor. The takeaway is not to feel overwhelmed. The takeaway is that there are real, identifiable reasons for this happening and real things that you can do about it. And so, circling back to our friend Dan, he eventually saw his doctor. He got his blood pressure under control. He made sure that the medication he took for his blood pressure was not going to contribute to ED. He made some lifestyle changes, and he worked through the psychological pieces with support. He and his wife have a great sexual relationship again. It took time and courage and honesty, but eventually it happened. And that can be your story too. Thanks for joining me for today's episode. Don't forget to subscribe, share the podcast with a friend who might enjoy it, and leave a positive review. Until next time, my wish is for you to create a life filled with phenomenal relationships and fabulous sexual intimacy. Thanks again. Bye-bye.